Hello, I'm Dr. Carlo Ojet, emergency physician with edexitvideo.com.
Today, we're going to talk about cervicitis. Cervicitis is a swelling or inflammation of the end of the uterus, called the cervix. Cervicitis is most often caused by an infection, usually caught during sexual activity. There are a lot of bacteria that can cause cervicitis, some of which include chlamydia, gonorrhea, herpes virus, human papillomavirus, and trichomoniasis. Bacteria such as staphylococcus and streptococcus and too much growth of normal bacteria in the vagina, bacterial vaginosis, can also cause cervicitis. However, in a few cases, it may be due to a device inserted into the pelvic area, such as a cervical cap. It's a device to support the uterus or a pessary ring, a diaphragm, and allergies to spermicides used for birth control or to latex in condoms. It can also be caused by exposure to chemicals. Cervicitis is very common, affecting more than half of all women at some point during their adult life. Risks include high-risk sexual behavior, history of STD or sexually transmitted diseases, many sexual partners, sex or intercourse at an early age, and sexual partners who have engaged in high-risk sexual behavior or have had an STD. Symptoms include abnormal vaginal bleeding, itching, unusual discharge, painful intercourse, medically called dyspareunia, vaginal pain, or pelvic pain or pressure. If the infection becomes systemic, you can have nausea, vomiting, fever, even chills. Tests done. Inspection of the discharge under a microscope may show candidiasis, trichomoniasis, or bacterial vaginosis. A pap smear can be done. Tests for gonorrhea or chlamydia are often taken and sent out for cultures. Rarely, colposcopy and biopsy of the cervix is necessary. Even though the physician will not get the culture results back during the emergency department encounter, if there is irritation or discharge, we are most likely to treat you empirically. Antibiotics are used to treat bacterial infections such as chlamydia, gonorrhea, and others. Either a shot, a single dose oral antibiotic dose, or a combination of antibiotics will be prescribed. Drugs called antivirals may be used to treat herpes infants if the physician thinks there is one. When these treatments have not worked or when cervicitis has been present for a long time, treatments may include cryosurgery, electrocauterization, even laser therapy. If untreated, cervicitis may lead to pelvic inflammatory disease, infertility, ectopic pregnancy, chronic pelvic pain, spontaneous abortion, cervical cancer, or other complications during delivery of a baby. Call your doctor or go to the emergency department immediately if you experience nausea or vomiting, fever or chills, increasing abdominal pain, or if your condition deteriorates rather than improves. Also, see your doctor immediately if your male partner has been diagnosed with urethritis, a urinary tract infection, or if he has symptoms of the condition such as pain, burning during urination, a thin discharge from the penis, or a stain in his briefs. If your partner is not treated, you will get the infection again. Do not have sexual intercourse until your treatment is completed and your symptoms have gone away for at least 7 days. For other videos like this, please visit edexitvideo.com. Remember, this is for medical advice and should never replace the exam or care of your physician.